Dr. David Agus joins us from his home in Los Angeles. David, very good to see you. I want to pick up on Ben's report about that hydroxychloroquine, because there certainly seems to be a big difference of opinion between the president and the doctors on his team. And as the president keeps pointing out, he is not a doctor. So what is the benefit? What is the risk of using this anti-malaria drug? Who's right here?
So hydroxychloroquine has been used for over 3 decades for malaria and I think more importantly for lupus here in this country. It is a remarkably safe drug. When you give it for lupus, we don't even check. If nobody has a history of heart problems, classically you don't even check the heart. And we're talking a period here of giving it for less than a week or maybe a little bit more in some cases. So the safety is there. The problem is the data showing it works were a rather small study in France and one in China. The data was there. The question is, were the studies well done? The answer is no. Were the studies definitive? No. So do we know it really helps this disease? No, but when you look at potential upside and potential downside, I mean, it certainly in the right cases makes sense to take that risk and use these drugs. We're at war now, and sometimes we don't have all the evidence we need.
Talking about being at war, I want to talk about what the Surgeon General said, because it was very ominous. He says, get ready for our 9/11 Pearl Harbor moment. It was very frightening to hear those words. What should we be preparing for this week?
You know, I'm just afraid of this week. I mean, this is a week we're going to see a growth in the number of deaths across the country. We're going to see certain cities really explode. All of us, fear this. It happens to all of us have a friend or somebody we know who's affected by this virus. It takes about 2.5 to 3 weeks from interventions to actually yield a flattening and then a decrease in the curve. So my hope and prayers are this is the last week till the interventions we all made start to kick in and we see a drop in the number of deaths and a flattening of that curve and then a major decline.
Dr. Fauci also said something very interesting on TV yesterday. He said half the people infected may not have the symptoms, and that's much larger than the estimate than what the CDC has told us. So what does this tell us about this virus?
Gail, I mean, this is telling us this is an insidious virus that we've seen nothing like it. He said 25 to 50% of the people can be asymptomatic. When you're asymptomatic, you feel fine, you go out, you do things you wouldn't have done. You take risks that probably are not appropriate, and hence the dramatic spread across this country. And it certainly scares me. When you see, areas where the pier in Washington, we saw pictures of this weekend, when you see church services, people going out, they don't want to hurt anybody, but they don't know they have the virus.
Yeah, if there's one thing that is universal, it is that we are all scared. Thank you very much, David Agus. Always good to see you.